I'm about to tell you something that could save your life. And it starts with that numb, tingling, or dead feeling in your feet that so many seniors brush off as just getting old. Numb feet are not just an annoyance. They can be an early warning sign that the blood supply to your legs and feet is in trouble, and that same circulation problem dramatically raises your risk of heart attack, stroke, and even amputation. The shocking thing is that there is a simple 2-minute leg trick you can do in bed that not only helps restore blood flow overnight, but can also reveal whether your circulation is dangerously compromised and needs urgent attention. I'm Dr. Claire Whitmore, and after 2 decades as a cardiologist, I've taken care of thousands of seniors with clogged arteries in the legs, what we call peripheral artery disease, and diabetic nerve damage who showed up too late. They started with just a little numbness and ended with a toe amputation, a major heart attack, or a stroke. Over and over, I've wished someone had taught them how to listen to what their numb feet were trying to say. By the end of this video, you'll know exactly what that 2-minute leg trick is, how to do it safely, what it can and cannot fix, and the step-by-step plan to protect your legs, your feet, and your independence. But I'm not going to give you the trick yet, because if I do, some of you will try it once, feel a little tingling, and go right back to ignoring the deeper problem. You need to understand why numb feet after 60 can be so dangerous before you decide how seriously to take this. Before we go on, comment below with your age and what you notice in your feet. Use a simple format like 72, numb toes at night, 80, burning soles, diabetes, 68, cold feet when walking, or 77, no symptoms. I read these. I need to see what seniors are experiencing and how old you are. Let me tell you about Earl. Earl was 76 when I met him. Retired truck driver, lived with his wife in a small house on the edge of town. On paper, he was not too bad for his age, as his primary doctor liked to say. He was 5'9", 196 pounds, with blood pressure hovering around 148/82 on a single pill. His cholesterol was borderline, LDL 132, HDL 41. He had type 2 diabetes for nearly 15 years, with an A1C of 7.4%. He still smoked about half a pack a day. His medications were metformin, a blood pressure pill, a statin, and a baby aspirin. About 2 years before I met him, Earl started noticing something odd when he drove. After a couple of hours behind the wheel, his toes would feel like they were made of cotton. At night in bed, he'd feel pins and needles in the balls of his feet. He mentioned this at his next checkup. His doctor glanced at his chart, saw the diabetes, and said, "That's diabetic neuropathy. It's common in seniors with long-standing diabetes. We can give you something for the pain if it gets bad." Earl said, "Doc, it doesn't hurt that much. They just feel dead." The doctor reassured him, "It's part of the diabetes. Keep taking your meds. Try to keep your sugars under control." Earl went home thinking this was just another inevitable part of aging. Over the next 6 months, the numbness crept from his toes into the balls of his feet. He couldn't feel the gas pedal as clearly. When he walked, he felt like he was on thick socks, even when he was barefoot. His wife June noticed he stopped going for their evening walks. When she asked why, he shrugged, "My feet are just tired." What he didn't tell her was that after walking about 1 block, he started getting a cramping ache in his calves, especially the right one. If he stopped and rested on a fence or sat on a bench for a minute or two, the pain went away. He didn't want to complain. "I'm 76, he told himself. "Of course my legs hurt." At his next appointment, his blood pressure was 152/86. His A1C had crept up to 7.8, and his doctor bumped up his diabetes medicine. Earl mentioned the calf pain. The doctor said, "That's probably just arthritis or muscle strain. You've been on the road your whole life. Try some Tylenol and see if it helps." No one checked the pulses in his feet. No one compared the color or temperature of his toes. No one ordered an ankle brachial index test, the simple blood pressure type test that can reveal blocked leg arteries. Over the following year, the warning signs multiplied. Earl's feet were cold to the touch, even when the house was warm. The hair on his shins thinned out. His toenails grew thick and brittle. At night, he liked to hang one leg over the side of the bed because, oddly, that made his foot feel a little better. This is a classic sign that blood flow to the foot is so poor that gravity is needed to pull a bit more blood down. Then came the moment everything changed. One summer afternoon, Earl was out in the yard and stubbed his right big toe on a brick. It bled a bit, but he rinsed it off, slapped on a band-aid, and forgot about it. A week later, June noticed his sock was sticking to the toe. When she pulled it off, the skin around the nail was dark red and swollen, with a small open sore that looked yellowish in the center. "We need to get this looked at," she said. Earl grumbled. "It's just a little sore. It'll heal." But it didn't heal. 2 weeks later, the sore was bigger. The skin around it looked shiny and tight. The end of his big toe started to look darker, almost purplish. The only pain he felt was a deep, dull ache at night when he lay down, and even that was less than you'd expect for how bad it looked. Why? Because his nerves were so damaged he couldn't feel how serious the injury was. Finally, one night, around 3 a.m., he woke June up. "Something's wrong," he said. "My foot feels like it's on fire and frozen at the same time." She turned on the light. His right foot, from the midfoot forward, was pale and mottled. The big toe was almost black. The foot was cold to the touch, and he could barely wiggle his toes. When he tried to stand, searing pain shot up his calf. June called 911. In the ambulance, the paramedics wrote down his vitals: blood pressure 182/96, heart rate 104. They checked his pulses at the ankles. On the left, faint. On the right, almost nothing. In the emergency room, an urgent ultrasound and CT angiogram showed the truth: severe peripheral artery disease in both legs, with a near-complete blockage of the main artery behind his right knee and poor flow into the foot. Tiny clots had lodged in the already narrowed vessels supplying the toe. The vascular surgeon and I stood by his bed to explain. "Eel," I said, "the arteries bringing blood to your right foot are almost completely blocked. The tissue in your toe is dying because it's not getting enough oxygen. We're going to try to open up the blockage with a catheter procedure, but I need you to understand, we may not be able to save the toe. If the infection spreads, we may have to take more." They took him to the cath lab and threaded a catheter into the artery. They were able to open part of the blockage and place a small stent. But the damage to the toe was too far gone. A few days later, the surgeon had to amputate the big toe. Earl came through surgery, but the wound was slow to heal because his circulation everywhere in that foot was compromised. He ended up needing months of wound care, antibiotics, and wheelchair use. He never drove again. His world shrank to a few rooms in his house. Here is the part that is hardest to say. A large part of this cascade, the toe amputation, the wheelchair, the loss of independence, might have been prevented if his circulation problems had been caught and addressed earlier, when he first had calf pain and numb toes. If he had learned a simple nightly 2-minute leg trick to test and boost his circulation, he would have noticed much sooner that his right foot turned pale when elevated, that his calf burned with minimal activity. He might have gotten an ankle brachial index test, started a supervised walking program, tightened his diabetes control, stopped smoking, and used specific positioning and exercises to improve blood flow before tissue started dying. I want you to pause for a moment and take an honest inventory. Comment below like this: age, symptoms. For example, 74, numb toes at night, diabetes. 81, burning feet, no diabetes. If you have open sores, color changes, black, purple, very pale, or severe pain in the foot at rest, add the word urgent. That doesn't replace a doctor. You still need to call, but it tells me how many of you might already be in the danger zone. Let's talk about what numb feet really mean. When seniors tell me my feet are numb, there are two big categories I think about: nerve problems and blood flow problems. Often it's a combination of both. On the nerve side, long-standing diabetes, vitamin B12 deficiency, alcohol use, chemotherapy, and spinal issues can damage the small nerves in the feet. This leads to burning, tingling, pins and needles, and eventually decreased sensation. That's diabetic neuropathy and related conditions. On the circulation side, peripheral artery disease, PAD, clogged or narrowed arteries in the legs, reduces blood flow to the feet, especially when you're using your muscles. This causes calf pain with walking, cold feet, shiny skin, and poor wound healing. And there is also the venous side, when the veins struggle to pump blood back up to the heart, leading to swelling, heaviness, and sometimes skin discoloration around the ankles. Most seniors have been told some version of, numbness is just normal when you're older, or once the nerves are damaged, there's nothing you can do. That's not the full truth. While we cannot reverse every bit of nerve damage or unblock every artery without procedures, we absolutely can improve how much blood your muscles and skin receive, and we can strengthen the muscle pump in your legs that helps your heart move blood. That's where this 2-minute trick comes in. Your calves are sometimes called your second heart. When you walk or flex your ankles, the calf muscles squeeze the deep veins in your legs, pushing blood back up toward your heart. Tiny one-way valves prevent that blood from falling back down with gravity. Arterial blood, the fresh oxygenated blood coming from your heart, is drawn down more efficiently when the venous side is working well. But if you spend long stretches sitting or lying with your knees bent and your ankles still, that muscle pump goes offline. Blood pools in your lower legs, pressure in the veins rises, and the tiny capillaries that deliver oxygen to your nerves and skin get sluggish. Seniors are different in a few key ways. First, your arteries are stiffer and narrower than they were at 40. Decades of cholesterol, blood pressure, and sometimes smoking leave plaque in those vessels. This means any drop in blood pressure or long period of immobility affects your feet more quickly and more severely. Second, your muscle mass is lower. With each decade after 60, you lose muscle unless you actively work against it, which weakens that calf pump. Third, your nerves are more vulnerable. If you have diabetes or B12 deficiency, the tiny blood vessels that feed the nerves are already compromised. Fourth, your blood is a little stickier. Clotting factors tend to increase with age, and many seniors are dehydrated, which means a higher risk of small clots and sluggish flow. Now, what does the research say about circulation and leg exercises in seniors? We have large trials like the Framingham Heart Study that showed seniors with peripheral artery disease are at significantly higher risk of heart attack and stroke because the same process clogging the leg arteries is happening in the heart and brain. We have randomized trials showing that supervised walking programs, where seniors walk to the point of moderate calf pain, rest, then repeat, improve walking distance and leg blood flow more than some procedures. Studies in journals like Circulation and JAMA have shown that even in adults over 70, structured leg exercises can increase the size and efficiency of the calf muscle pump, reduce symptoms, and in some cases improve the ankle brachial index. We also know from ultrasound studies that simple ankle pumping and leg elevation can significantly increase venous return, the amount of blood getting back to the heart, and reduce leg swelling overnight. What almost nobody has told seniors clearly is that a short, specific sequence of leg positioning and movements before bed and upon waking can make a real difference in blood flow, especially when combined with medical care for blood pressure, cholesterol, and blood sugar. For decades, many adults over 60 were told something like, "You've got neuropathy, we'll manage the pain, but just be careful with your feet." The focus was on pills to numb the burning sensation. We now understand that was only half the story. We ignored the fact that improving blood flow and muscle pump function can protect the remaining nerves and tissue, slow progression, and in some cases reduce symptoms. The contrarian truth is this: you may not be able to cure neuropathy or completely reverse PAD at home, but you absolutely can wake up the circulation in your legs every day with a very short routine, and you can use that routine as an early warning system. If your foot turns white, purple, or painful with certain positions or simple movements, that is your cue to get evaluated before things become critical. You're probably thinking, "All right, Dr. Whitmore, enough build-up. What is this 2-minute leg trick and how do I do it without hurting myself?" I'm going to tell you step by step. But I need to say this clearly first. If you currently have a foot that is suddenly cold, pale, or blue, severe pain in the foot or leg at rest, or an open wound that is black or foul smelling, stop this video and call your doctor or emergency services now. Do not wait to try and exercise. Those are signs of a possible medical emergency. Assuming you don't have those red flag signs, here is the core idea. We are going to use 2 positions and 1 simple movement to harness your calf pump and encourage fresh blood flow into the feet while clearing out pooled blood in the veins. You can do this in bed in about 2 minutes before you fall asleep and again when you wake up. First, check with your doctor, especially if you have severe back problems, recent hip surgery, or on blood thinners with a high risk of bleeding. Tell them you'd like to start a short nightly leg pump routine to help your circulation and ask if there is any reason you should not elevate your legs or pump your ankles. Now, here is the 2-minute leg trick. Step 1. Elevate and drain. About 60 seconds. Lie on your back in bed. If you can, place a couple of pillows under your calves so that your feet are slightly higher than your heart. If that's hard, scoot down so your feet rest up on the wall or the headboard at about a 45-degree angle. You don't need your legs straight up in the air, just comfortably elevated. Once your legs are up, spend about 30 seconds simply resting them there. Then for the next 30 seconds, begin gentle ankle pumps. Point your toes away from you, then pull them back toward your nose like you're pressing and releasing a gas pedal. Do this rhythmically, about 1 pump per second. This squeezes the veins in your calves and pushes pooled blood back up toward your heart. Step 2. Dangle and refill, about 60 seconds. After about a minute of elevation and pumping, slowly lower your legs and swing them over the side of the bed so your feet hang down toward the floor. Sit at the edge of the bed with your feet dangling or lightly resting on the floor. Now do another 30 to 60 seconds of gentle ankle pumps and circles. Draw circles with your toes, then reverse direction. While your calves pump, gravity is pulling fresh arterial blood down into your feet. Many seniors notice their toes pink up and feel warmer during this phase. That's it, 2 minutes. Up and pump, down and pump. But here's the key. Consistently doing this twice a day at night before sleep and in the morning before you stand up can, over weeks and months, improve venous return, reduce nighttime swelling, and gently train your calf muscles and vessels to move blood more efficiently. You are not trying to force anything. You should not be gritting your teeth. The effort should be light to moderate, enough to feel your calf muscles working, not enough to cause pain. If you feel sharp pain, cramping that doesn't go away with rest, or your foot turns white, purple, or blotchy and does not return to normal color within a minute, stop and tell your doctor. Now that 2-minute trick is the starting point, not the entire plan. Let me give you your complete action plan to protect your legs and feet. First, inspect and document. Every evening when you do your leg trick, take 10 extra seconds to look at the skin on your feet and toes. Use your hands to feel the temperature. Is one foot cooler than the other? Do you see any new sores, blisters, or dark spots? Is the skin shiny, hairless, or reddish-brown? Once a week, write down what you see. This transforms "I think my foot looks worse" into concrete information. If you see an open sore, black area, or spreading redness, call your doctor promptly. Second, measure your walking tolerance. Peripheral artery disease often shows up as calf pain or fatigue with walking that improves with rest, called claudication. Choose a safe, flat path in your home or yard. Walk at your normal pace and note how many minutes or how far you get before your calves feel heavy, tight, or painful. Stop, rest, and note how long it takes for the discomfort to ease. Write this down once a week. If your distance is shrinking, that's a sign your circulation may be worsening. Third, practice the 2-minute leg trick twice a day for at least 4 weeks. Before bed and upon waking, elevate and pump, then dangle and pump. If 2 minutes is too much at first, start with 30 seconds in each position and build up. Many seniors notice within a week that their feet feel a bit warmer, that nighttime throbbing improves, or that their morning stiffness is less. Fourth, add a short walking routine if you can. After a week or 2 of the leg trick, and with your doctor's okay, add a simple walking prescription. Once a day, walk on level ground until your calves feel a moderate ache or heaviness. Not agony, but discomfort. You'd rate maybe a 5 out of 10. Then stop, sit, or stand still and wait for the discomfort to ease. Repeat this cycle for a total of 15 to 30 minutes. Studies in seniors with PAD show that this walk to discomfort, rest, repeat pattern can open up collateral vessels, improve your ankle brachial index, and increase your pain-free walking distance more than just ambling without effort. Fifth, optimize your risk factors. While the leg trick and walking are powerful, they are not magic wands. Your arteries respond over years to blood pressure, cholesterol, and sugar. Work with your doctor to keep your blood pressure near a safe target for your age, your LDL cholesterol as low as appropriate, often under 70 or 100 depending on your history, and your A1C in the range your doctor sets. If you smoke, I cannot say this strongly enough, quitting smoking is the single most powerful circulation trick you will ever do. No leg exercise can undo the harm of lighting another cigarette. Sixth, protect your feet from trauma. Because numb feet don't feel injuries well, make a few non-negotiable rules. Always wear shoes or protective slippers. No walking barefoot on hard floors. Check inside your shoes for pebbles or rough seams before putting them on. Cut your nails straight across. Or see a podiatrist if you can't safely reach them. Never use heating pads directly on your feet, as you may burn yourself without realizing it. Seventh, schedule a vascular checkup. If you have numbness, calf pain with walking, non-healing sores, or a big difference in color or temperature between your feet, ask your doctor for an ankle brachial index (ABI) test. It's a simple, painless test where they compare blood pressure in your arms and ankles. An abnormal ABI can uncover PAD before it leads to an ulcer or amputation. If your ABI is abnormal, you may be referred to a vascular specialist for further imaging and discussion of medical and sometimes procedural options. Seniors ask me a lot of questions about this. One is this 2-minute leg trick safe if I have varicose veins or leg swelling? In many cases, yes. Gentle elevation and ankle pumping can actually help venous return and reduce swelling. But if you have a history of deep vein thrombosis, DVT, blood clots in the legs, or if one leg suddenly becomes very swollen, red, and painful, you need to talk to your doctor before starting any new leg exercise. Another common question: My feet are numb from neuropathy, not circulation. Will this still help? While the primary problem in neuropathy is nerve damage, those nerves are still dependent on tiny blood vessels. Improving circulation with the leg trick and walking can support whatever nerve fibers you have left. It may not reverse the numbness, but it can prevent worsening, protect your skin, and sometimes reduce burning discomfort. Some seniors worry, if I elevate my legs, won't I cut off blood flow? In severe advanced PAD, some patients do feel worse with leg elevation. Their feet may turn pale and hurt. That's precisely why I tell you, if you notice your foot becoming very pale or painful with gentle elevation, and it only feels better when you dangle it down, that is a red flag that your arterial disease may be advanced. You should not keep pushing through that at home. You should call your doctor and mention what happened. You may also ask, can I just wiggle my toes in my recliner instead? Toe movement is better than total stillness, but it is the ankle pump and calf squeeze that make the biggest difference for circulation. The 2-minute trick is about focused, purposeful movement in positions that harness gravity, up to drain, down to refill. And please hear this clearly. Never stop your blood pressure, cholesterol, or diabetes medications because you started exercising your legs. The leg trick and walking are powerful partners to your prescriptions, not replacements. If anything, improved circulation may make your medications work better. Now, I want to share a different kind of story, one that shows what can happen when a senior takes numb feet seriously and uses this kind of routine consistently. Her name is Harriet. She was 78 when she came to my clinic, brought in by her son. She had type 2 diabetes for 20 years, high blood pressure and high cholesterol. She was 5'4", 172 pounds. Her A1C was 7.9%, her LDL 124, and her blood pressure 154/88. Her main complaint was, my feet feel like blocks of wood. She described numb toes, burning at night, and occasional calf cramps when walking to the end of her driveway and back. She had no open sores yet, but the skin on her shins was shiny and hairless, and her feet were cool compared to her calves. Her primary doctor had said, that's diabetic neuropathy and some circulation issues. Wear good shoes, keep sugars controlled. Harriet, to her credit, wanted to do more. When I examined her, her pulses at the ankles were weak. Her ABI came back at 0.68 on the right and 0.72 on the left, moderate peripheral artery disease. We sat down and laid out a plan. Her eyes widened when I told her about the 76% higher risk of heart attack and stroke associated with PAD and how numb feet are often the first whisper. But she also lit up when I explained that even at 78, her legs could respond to daily small efforts. We optimized her medications, tightening her blood pressure control and adjusting her cholesterol pill. We set a target for her A1C to gradually come down. But equally important, we taught her the 2-minute leg trick. Her son filmed me demonstrating, lying in bed, feet on pillows, 60 seconds of gentle ankle pumps, then sitting at the edge of the bed, feet dangling, 60 more seconds of pumps and circles. We asked her to do it every night before sleep and every morning on waking. We also prescribed a walking routine, starting with 5 minutes on flat ground until her calves felt moderately tight, then resting, repeating for a total of 15 minutes, 3 days a week, building up to 30 minutes most days. At her 6-week follow-up, Harriet walked into my office with a different posture. My feet still feel numb, she said honestly, but they feel warmer when I go to bed. That deep ache I used to get at 3 in the morning is a lot better, her son added. She's walking to the mailbox and back twice a day now, instead of once. At 3 months, her ABI had improved modestly to 0.75 on the right and 0.78 on the left. She had lost 5 pounds without aggressively dieting. Her blood pressure was down to 138/80. Most importantly, she had no ulcers, no falls, and more confidence. On her own, she had started putting on her favorite music during her leg routine, which made it something she looked forward to instead of a chore. At 12 months, we repeated her vascular tests. Her ABI was stable in the high 0.7s. Not perfect, but not worse, which in PD is a win. Her A1C had dropped to 7.1%. She reported that the burning in her feet was less intense, and she was back to walking around the block with a neighbor 3 times a week. When I asked what she thought made the biggest difference, she said, honestly, that little pump routine, it reminds me every day that my feet matter. It's like brushing my teeth, but for my blood flow. I think about Earl every time I teach the 2-minute leg trick. I picture his numb toes on the gas pedal, his calf pain on that 1-block walk, his cold foot hanging over the side of the bed at night. Those were not just random annoyances. They were his body begging for attention, for movement, for blood. If someone had taught him how to gently drain and refill his legs every night, how to notice color changes when he elevated his feet, how to track his walking distance and bring that data to his doctor, his story might have been very different. Maybe he would still have all his toes. Maybe he would still be driving June to visit the grandkids. You now have the knowledge he didn't have. You understand that numb feet after 60 are not just old age. They can be early signs of nerve and blood vessel damage that threaten your legs, your heart, and your brain. You understand how the calf muscle pump works as your second heart, and how a simple sequence of elevation, ankle pumping, and dangling can wake that pump up in just 2 minutes. You know that there are red flag signs, sudden cold, pale or blue feet, rest pain, non-healing sores that demand immediate medical attention, not home exercises. And you see that even at 78 or 80, with diabetes and PAD, seniors like Harriet can stabilize and even improve their circulation with consistent small actions. This information is power, but only if you use it. Tonight, before you fall asleep, don't just slide into bed and ignore your feet. Lie back, elevate your legs, and do 60 seconds of gentle ankle pumps. Then sit at the edge of the bed, dangle your feet, and do another 60 seconds. Look at your skin. Feel the temperature. Tomorrow morning, do it again before you stand up. Over the next few weeks, pay attention. Do your feet feel a bit warmer? Does that dull ache change? Can you walk a little farther before your calves complain? Talk to your doctor, bring up your symptoms, ask for an ankle brachial index if you have risks. Tell them you are doing a short daily leg pump routine and ask if there's anything you should modify. Don't let anyone wave away your numbness as just getting old without a proper look. Before you leave, do 3 things for me. Subscribe if you want more direct, honest guidance about protecting your circulation, heart, and independence after 60. Share this video with at least one friend or family member who has numb feet, leg cramps when walking, or a history of diabetes. You may spare them the path that led Earl to amputation. And leave a comment with one of 3 phrases. Trying the trick if you're going to start the 2-minute leg routine tonight. Already doing it, if you've been doing something similar and this confirms it. Or talking to my doctor. If today's story convinced you to get your circulation checked. Your feet are your foundation. They are often the first place your arteries and nerves whisper that something is wrong. Listen to them, move them, help them bring you safely through many more years. Disclaimer, the content in this video is for educational purposes only and is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician regarding your medical condition. Never change your medication dosage or start a new exercise routine without consulting your doctor.